Well, good morning out there. Monday after Easter, interestingly enough, and I posted over the weekend my, I don't know, the idea that we gave up our freedoms for Lent. So
Good morning.
Monday after Easter, I'm wanting this morning to once again share Robin Williams' story here or presentation that I really enjoy, and I think it's appropriate because as we move through these next coming weeks, there's interesting information that's come out and changed on the CDC website that I think it's important we cover today. So we're going to get there, but for right now, let's just take a moment again to listen to what it's all about. Because I don't think anybody gets it any better. He sure did.
I'm the one that they're singing about. Yeah, I'm the Stars and Stripes forever. Star Spangled Banner. You can call me Old Glory, but let's just keep it simple. Just call me Flag. Oh, say, can you see? Okay. Little flag humor. Well, you probably don't recognize me. Say, who is that? Evel Knievel? No way. Yeah, you see, you can't recognize me because
I'm in my birthday suit, yes.
I'm wearing the original 13 here. Yeah. I remember Miss Betsy sitting there going,
well, this could be the start of something big. Whoa. Oh, Tom, don't be a pain.
yes. I was born June 14th, 1777. That makes me a Gemini. Unpredictable, crazy. Yes, I like the outdoors, and I'm the life of any party, whether it be Republican, Democrat, Independent, Socialist, anything libertarian, I'll be there. You know, I'm 204 years old. People say, Flag, how do you stay so young? Is it jogging? No. Is it tennis? No. It's waving. Billowing, furling, and unfurling. Richard Simmons, eat your heart out. Yeah, but it hasn't always been easy for me, though. I had a tough puberty. Yeah, war, famine, invasion. And 1861, well, I had a little skin problem that broke out into 34 stars. But now, well, a little patience, and look what we got now. Look at this. Hold on here. Ha-ha! Ha-ha! Everybody's on here. Look at this. Alaska. Yeah, we got your Tennessee. How are you doing today? Here's Vermont. You can't get there from here. Oh, and there's California. For sure, totally. Like I said before, you know, I had a tough time for a while. I've been in a lot of wars. They fired missiles and muskets at me, but you know, come the dawn's early light, I'm still there. You know what I'm talking about? You know, I've been made into everything from designer jeans to t-shirts, and I've even been a cape for Mick Jagger. Well, all right! The rocket's red glare, we're all right! But people haven't always been respectful to me. Sometimes it's been tough. There have been some people try and spit on me, trample me, burn me. Foreigners and occasionally some Americans too, but I don't let it get me down because I'm not a stay-at-home kind of Flag. You know, I've been to Europe. I've been to both North and South Pole. I was at Iwo Jima. Recently, I've even been to the moon. I don't mean to bum you out. I didn't come here to depress you. But I gotta tell you something honestly. I haven't been getting out much lately. I guess it's not very chic to put up the flag anymore, you know? Muffin and I have a flag, but we haven't found it for very long. Hey, but look at it this way. Don't look at it as saluting me. Look at it as saluting yourselves. You know, hey, I'm just a flag, a symbol. You're the people. If I may say so from here, long may you wave.
All right. So, last share there with him was very important. You know, it's we the people, and we need to start taking some action. And one of those actions could have been, before we got 6 inches of snow, is putting out a new flag or putting out a new flagpole. And I'm throwing out the challenge to everyone in Wisconsin and everyone in the country to put up a flag this year to show that we're still committed to the Constitution, the Declaration of Independence, and our freedoms, and that we're not going to tolerate this anymore, and that politicians who are all up for re-election here come November, beware. If you're going to choose to be secretive and not share with us, or then they're going to be voted out. So our vote is very important this year, even more so, and making an educated vote becomes even more important. So as always, thank you for joining the show today. I really do appreciate it. And here early on again, I'm going to say, hey, subscribe to my channel. That way you'll get notifications if you're just joining us for the first time. And those of you who are already subscribed, thank you very much. Please like my videos. It helps them get out in the search engines, and I get more views, which helps the channel and helps the message get out there. I mean, if you appreciate my message, agree with my message, think my message, Twitter, whatever that might be, because it can't hurt anything. It can only help to create interest and people being inquisitive to trying to get all the information. You know, again, too, we're trying to see what our leaders are doing for us. And here in Wisconsin, and I would recommend, I mean, the governor continues to lock us down and close things and put pressure on us to stay in our homes and limit data, and he's trying to push through the party, which we don't know what's going on with. And I mean the party with the legislature, but we don't know what's going on with our legislature because their mum's the word. I mean, they've released no information. I mean, and it's absolutely asinine again, because we should be getting information on what they're working on. And why is it a secret? But his bill, once again, made a decision on his own to impose his will, or in multiple states, see reductions in their work. So what did they do? They laid people off. In some cases, maybe they fired them. And you know this because of the rise in unemployment. What's important to note as I talk about Governor Evers' bill is that the unemployment fund or trust or whatever they do with the money that they collect for unemployment is currently $2 billion. And if that's not a rainy day fund, I don't know what is, because I've even been told that we, on average, on a regular economy, have very few people on unemployment, meaning that $2 billion has been sitting there, meaning his feelings are we need to shut the state down because we've got to curb this virus. Right or wrong, if that's what his decision is, he absolutely has to take into consideration the cost. And the cost needs to not be shifted to the citizens, but instead should be carried by the state. Because if the citizens are going along their merry way and doing their jobs and working hard and getting paid and contributing to the economy and being a consumer, and then they get laid off because of no reason that they can control, and the state and single people in every state are making unilateral decisions to just shut everything down, well, then they need to take care of it. And if the state of Wisconsin's got $2 billion, the same portion of his stay-at-home order should have addressed that people that have lost their jobs recently and are on unemployment would then have their salaries covered until this emergency is over, and then for a short time after, until people are able to get their jobs. I am in no way advocating that people who go on unemployment should stay on their full salaries forever. That should be the new policy. It's an emergency policy. The government of Wisconsin and other states made decisions to shut down the state, impact the economy. Instead of focusing on the citizens as a consumer, they're focusing on businesses. How can we help the businesses? How can we get more money to the businesses? That's asinine. The money needs to go to the consumer. The consumer then consumes, and the businesses are fine. And the businesses have to do what they do every day as a businessman. I've got to go out and market and gain market share every day. Just like with this show, I have to continue to try to produce something that people find interesting and informative. And then that way they'll go ahead and subscribe and share, and more will. And then this produces its own stream, if you will, stream of information, stream of followers, and in some cases, as the channel grows, I could even start to make money from the channel. At present, I don't, but I mean, that would be nice because I'd like to do this full time, and with having to stay home, that would make it very easy to be at home, making my income from producing informative shows for everyone and entertaining, whatever, and as any other show, just entice the consumers to do that. There's tons of technology to do that with. They pay all kinds of taxes through those dollar thing for the banks, which was absolutely ridiculous. That didn't help anyone, and everybody lost their homes. Home values plummeted, which not only affected the people who lost their homes, but people who owned their homes and were using the equity in their homes to do things on their farms or do things on their residences in town. I mean, that whole has this just cascading effect. So the way you fix that is keeping that flow going through the consumer. That's the only way it works. And when you look at economies, it never works when you cut out the consumer. When you focus on the business and you focus that support on the business, then you're not getting anywhere. So we need to continue to push the governments of this country, and in particular where I'm focused is in Wisconsin, to provide support to the people who are just trying to get through this and get back to work. There's nobody here saying, I don't want to go back to work. In fact, I'm looking for work every day, and I'm running my businesses, and I'm working on trying to make this a business, but it doesn't produce any income yet. And I've got to continue to be creative and try to get your interest in my show. And I appreciate everyone who's joining me either live or later watching the video. On that note, then, Governor Evers' current description of the bill doesn't address one, sufficient unemployment. $370 a week, not even close. Don't use the federal $600 a week as a crutch. I want to know what the state of Wisconsin is going to do. You have people who are making far more than even $1,000 a week who have lifestyles that just can't turn on a dime. The mortgage doesn't stop. The what it costs to maintain the home doesn't cost. Having 5 kids doesn't. You're not going to get rid of your 5 kids. I mean, you were working, you had a good income, you have children in programs, you have children in school, you have to do things for them now when they're at home. I mean, instead of them eating at school, they're eating at home. So, I mean, there are all these things that go on that the government of Wisconsin and all the governments in the country need to protect people and the citizens, and that's where it needs to be focused. The other thing that nobody's, I mean, not even at the federal level, anybody's talking about is health insurance. I mean, we watch these shows, and we're going to watch a little bit of Philip DeFranco again today, but, you know, we watch these shows, and none of them talk about health insurance. None of them talk about just the incredible cost health insurance poses. So yeah, great, you're getting $1,000 a week if you take the $370 and you round it up with the $600 from the federal government. If you're paying taxes on that unemployment, that makes it even less. And then if you've got to pay so much a week for and if they removed the restrictions and just basically said during the emergency, everybody who's not working gets Badger Care. And you simply put everybody on Badger Care, and now everybody has health insurance. They don't need to worry about it. It's paid for, and whatever the governor and the state need to do, fine. And then we have a certain amount of time afterwards to get our jobs. And how you motivate people is you don't give them a never-ending portion of that money, you say, okay, listen, we're ready. Everybody's back to work. Everything's removed. Everybody goes back to work. And you're going to get 2 months to get that figured out. Or 3 months. I don't care. Even at 2 months, it's something better than nothing at all, which is what's happening right now. We still don't have a bill. I mean, unemployment still hasn't changed. I mean, we're not getting the extra $600 yet. It's still only the $370 a week. And that's just irresponsible. And it needs to change. And if you go to Governor Evers' Twitter account, you go to Tom Tiffany's account, do nothing Tom Tiffany says he wants to represent us. But so what is he doing? I mean, ask yourself that. What has he done? What has he done to make sure people have health insurance and don't have catastrophic issues if they get sick when they don't? And then they got a $50,000 bill they got to pay for that they didn't have insurance to cover. And we've talked a lot about the difference between cash price versus insurance price when you contract. And a lot of people, I think, don't understand that. And that is what puts the incredible burden on someone who goes to the hospital and has to have something done, doesn't have insurance, and then can't pay for it. And then not only does that put a burden on the other to make sure they have health care. And as I said, the bill is still not passed. And, you know, I did want to make sure I shared with everyone that I have provided a temporary or emergency bill to Representative Culp, Representative Petrowski, and numerous other senators, along with the governor, that it just hasn't been responded to. I mean, nobody's called me. I've tried to call and there's no response. Tried to email them, tried to email their publicity people, and nobody's responding. I mean, we should really, really, really be concerned about the fact that nobody wants to respond and everybody wants to keep everything a secret, and we're hearing nothing. I mean, you really should be calling your senators, you really should be calling your representatives and asking why that's the case. Under my bill, I indicated everything I talked about, that people's salaries should be covered during this time on unemployment, and they should be allowed on Badger Care, and it's done. And people don't have to worry, and they don't have to deal with the stress, and we will help things with issues of depression. People will be able to be comforted in the fact that as soon as the economy gets going, they can go and find a job, but in the meantime, the state's taken responsibility and help them out. So if you agree with that idea, please, again, share this video and let people know through your sharing what kinds of things are being talked about here. COVID-19. So interestingly enough, moving on to the COVID numbers with the CDC, if you remember in other shows, we looked at every morning, we look at the case information that's shared on the CDC website. And so we are looking at currently, it says total cases 525,704, and then total deaths are 20,486. Now, if you remember, during that time, we had this chart, which basically just summations the total number of cases that have been reported. So that curve, of course, will always go up. It'll never change. Even if it goes down to 1 case a day, that chart will just keep going up because the number will be increased. See it, and it's gone. Oh, it just came back on. Look it, there it is. Okay, it wasn't there when I started the show this morning. Awesome. So again, if we look at what's happening here, the trend is going down. And we're seeing the cases go down that are being reported every day. So that's good news. And that's kind of information we need. But if we go back to the information again on the total cases for the country, 20,486 still hasn't reached how many people will lose right now this season. It's going on right alongside COVID-19 for the flu. 32,000 or more people will die from the flu, and we don't shut the country down for that. So I'm still asking the question, why are we doing this? Why was it so important to do this? And then again, there's such a battle not to use hydroxychloroquine. to fight this. And there are so many doctors out there saying, and even I talked to my brother here over the weekend, and he mentioned that he has someone presenting this same stories on YouTube where, you know, between this combination of that drug, hydroxychloroquine, and zinc, people are, you know, in some cases within 24 to 48 hours recovering from COVID. If you want to call it recovering, it'd be no different than getting an ear infection when you have the flu or the cold, and then you take an antibiotic and you start to feel better, right? I mean, we do it all the time. So I'm not understanding this push to stay away from that drug. We've been using it for a long time. I'd have far more confidence in taking that drug than, again, anything that's just made up in the last 4 months. I mean, you should be really skeptical of someone saying to you, okay, well, here's this new drug we had in 4 months. We haven't had any real time to test it. We have no data for the background of that drug. You know, you can take it at your own risk. I mean, that's what you're doing. It shuts down your kidneys or causes you to have a heart attack. I mean, if they haven't done proper testing and they haven't created proper populations to monitor and groups to monitor who are taking the drug, both in a placebo and in the drug itself, they don't have any data for you. And don't buy anything they're telling you because there isn't any. Much like the fact that they're still not comparing this data across the fact that if you've watched, there's a video from that German scientist who talked about the fact that the COVID virus has been a strain of flu in the system for many years. So COVID has been around, and the question is that it's always been in my mind is that COVID virus in the flu shot? Now you realize I didn't say flu vaccine. Is there a strain of COVID that people are taking in the flu shot to expose their systems to it? That could be why, if we go to Wisconsin, the way they're reporting their data, hang on for my slow internet, they've had negative test results of 35,916. Well, we know for a fact that you can't just go to your doctor today. I feel great, right? But I'm concerned I've got COVID. I haven't got any symptoms, but I'm concerned. I want to test. I'm not going to get tested until I start presenting symptoms, and that could simply be symptoms from the flu. I'm not going to be tested. So that means this is 35,916 people that are sick. And that they're presenting some kind of symptoms that warrant being tested. So that means 35, almost 36,000 people who were sick were tested and were negative. And then in addition to that, another 3,341 people in the same boat were tested and were tested positive. In that 3,341 people then in Wisconsin, how many of they were hospitalized? They finally looks like they put that out. Only 974 people out of 3,341 people testing positive are hospitalized. So it's only about where it's been, 25% of the groups that are testing positive, which has been pretty stable. It's stayed at that rate throughout the virus. Are going into the hospital. Well, 500,000 people go in the hospital a year, over 12 months from the flu. So if you take that, that would be like 50 states times 10,000 people, 50 states times 1,000 people. So 50 states times 1,000 people would be 50,000 people. In 50 states at 10,000 would be 500,000. So we're still only at 10% of how many people go in to the hospitals by state. If there's about 10,000 people a year in each state that go in for the flu. Again, I'm just trying to share the data because I'm trying to figure out what the major heartache is with this process. Again, I'm not advocating that I think people should die, but they do, and they die from influenza. I mean, and they do every year, and we don't do this. And we have a drug to help people, and for some reason, we're just hesitant to move it forward. I mean, to be honest, if we're so concerned, people should be just taking it. and building their immune systems, and they should be testing everyone every month. Put people on hydroxychloroquine and see what happens. Find people willing to take it, those who aren't sick and those who are. And we have so many companies able to produce drugs in this country that this shouldn't be a problem. And because we produce it for probably down into South Africa for malaria, maybe we should be pulling some of that back and directing it into the States and getting the supplies into the people here in the US. Just a thought. So far in Wisconsin, out of 974 hospitalizations, there's 144 deaths. Interestingly enough, there's no percentage there, but we can do that math. So if it just rounded to 1,000, 10% would be 100 of the hospitalizations. So of people hospitalized, it would look like about 14% of those people are dying, which is still very small. Versus if you compare it to the number of people getting the virus, it's more like 3.5% or 4%. So, that seems to be the idea being put out against the number of people testing positive. But it doesn't talk about the overall population where we talk about the death rate. So when you look at the fact that 35,000 people, 36,000 people are testing negative, and that's not even the entire population of Wisconsin, that death rate goes down even more. I mean, it's easy to compare it to positive test results and then say that the mortality rate is this. We present mortality rates against the overall population. So why aren't we doing the same thing? Why aren't we looking at the whole population and saying, well, we've got 20,000 deaths against all these many millions of people. It's still very small in comparison to other things people die from here every day. And we need to explore that idea. All right. So as always, keep looking and text during the show, call during the show because I can receive texts from you on that number, and keep presenting your thoughts and ideas. And that number again, 715-352-0801. Call, text, chat on the YouTube channel. Leave comments. Please leave comments. I mean, anything, any information, links, because even the viewers like that ability to go somewhere where you're referencing something. So, and please don't feel like you can't do something because somehow it's negative. Go ahead. I'm not afraid. You can say whatever you want, and unless it's really bad, it'll be just fine. And we'll leave it up there for people. As again, I'm very much promoting contrary views, and I'm looking for your contrary views because that's how we get the right information. I mean, that's how businesses make decisions. They have groups who argue about what they think is going to happen or what they think needs to be done, and then they come to consensus, and it's never perfect. Somebody never walks in the room and says, hey, this is what we need to do, and everybody goes, oh, let's do that. Oh, yeah, that's utopia, isn't it? No, that doesn't happen. So everybody needs to have their view, everybody needs to pull the data together, and then everybody needs to find some middle ground that works and gives the group some direction based on the overall group. And it's always, in cases of businesses and boards of directors, it's always a majority rules type atmosphere, just like majority rules here, except for the fact that we've allowed governors to just bypass majority rules and simply impose this kind of restriction on us, which is bad. And I'm putting the call out to the legislature to change this now. There should be a bill on his desk changing this and making him seek approval from the legislature before he does anything else. And he's irresponsible for not doing it. He could have involved the legislature as part of his decision. He could have made what he likes to tell everybody he's about, a democratic decision, and said, you know what? This is so serious, I should not be making this decision on my own. And he should have gone to the legislature and not made a decision until they voted. Like it or not, in a republic, as we are, and in a democratic process, you have to wait for the vote. And That's part of the process where the people make a decision through their representation to do something, anything, especially this extreme. And don't tell me you're all for a democratic process and you're representing the republic and you're for the people if you're going to make a unilateral decision on your own and not back it up by something else. So Governor Evers made the decision for whatever reason, decided he needed to be king, and now we're living with it, but he's doing nothing to protect the people as this goes through. How would we do it differently? As I just said, the legislators should have voted, and them as well. If they're going to vote to take this kind of extreme action, the same thing needs to happen. The backside needs to say, well, but before we do that, how are we taking care of the people? Because it's really easy to just shut the place down and then just say, well, we can't get together, because that's the current excuse by the legislature. Well, we can't get together right now because it's so difficult and we have no technology. And I'm sitting here with 2 iPads. One of them's very old. And I'm recording live to you, and I'm showing you on my really old iPad video, and I can teleconference on that iPad. It doesn't have to even be new. It can be, this one's got to be 8 years old. And I can still watch YouTube. I can still get on Zoom. I can still connect to the internet. I can get on Zoom, and I can meet with hundreds of people at once. So it's just an excuse. And I'm sorry, it's a lie. So that was all of that for today. The last thing I wanted to cover was I was watching Philip DeFranco over the weekend, and he had an interview with Mr. Yang, who was running for president, which made him go into a discussion of UBI. And if you're not familiar with UBI, it's Universal Basic Income. And it's an interesting topic because they're talking about all kinds of crazy shit that I just don't understand. Because, while that idea might work, because, think about it. Up in Alaska, the people and residents of Alaska are paid each year a certain amount of money based on what the oil industry in Alaska makes. So there's nothing tied to taking that money. There's every year, part of the budget for the revenue that Alaska takes in from oil is redistributed to the population, and I don't know how much they get anymore. I had relatives who we've talked about from time to time, and sometimes you've heard it's been $1,000 a year or so much per month. But that would be a form of universal income that they're not doing anything to generate. They just live in Alaska and they're residents of Alaska and they get a check, which is basically what universal base income says. You live in the United States, you pay taxes in the United States, therefore you get this base income. Well, what's driving that base income? We're $22 trillion in debt now. How are we going to fix the current budget and be able to provide a universal basic income? Because they're talking like $40,000 a year. They can't even fix unemployment right now to be more than $370 a week, which is absolutely ridiculous, even on a regular basis. And I'm in no way saying we need to replace people's income, but you got to do something better than $370 a week, because it's supposed to be short term. And we can't even then say, well, if you get on unemployment, you're just automatically on Badger Care to help people make sure they have coverage during that time. And we have people who want to get rid of pre-existing conditions as part of the health insurance industry, which then makes it even worse, because if you lose your job and you lose your insurance and you can't afford the COBRA payment, and you have a month or even a day that you have no coverage, you then have to go a year in most cases, depending on what they change it to now, before you can have those conditions covered. So if you're a diabetic or if you have cancer and you lose your insurance, then that you can't get coverage for a year. Can you imagine someone having cancer who can't get coverage for a year? Can you imagine a severe diabetic who needs continuous monitoring, who can't afford their monitors, so they're not using them? How would they do that? Some of these packages you pay for cost $1,000 to $1,500 for a 90-day supply. My drug for my diabetes costs $1,000 for 90 days. And we're saying, what the heck? They don't have any income, but they can just take care of it. They're going to just find $1,000. How are they going to do that? Well, they're not going to pay their mortgage. Oh, well, that's just fine. They could lose their house. What does it matter? We live in America. Heck yeah. Let them lose their house. They'll get another one. Definition of an ass. So let's.
Four principles: universality and unconditionality. Universality means that UBI
almost there.
be open to everyone to get treatment for common health issues, and Roman is $8 a month.
Connected to touchpad.
People to lose their jobs and creating serious concerns around the policies that have been proposed and even tested over the years. But let's focus specifically on UBI for right now. Right, UBI is essentially a fixed amount of money given to people on a regular basis with no strings attached. And while experts don't agree on an exact definition for UBI, there is a general consensus of two core principles: universality and unconditionality. Universality means that UBI must be open to everyone, although there is some debate whether that means literally everyone, just adult citizens, or if permanent residents would be included as well. And unconditionality means that there can't be any conditions or qualifiers to restrict how often the payments are made and how it's paid for. There are also a lot of different arguments both for and against UBI. Now, we won't be able to cover every single possible detail on this topic because that would take literal hours, but just specifically has gained momentum over the last few years for a number of reasons. One big argument is that UBI could be an answer to rising fears and concerns about automation, the idea that many people will eventually lose their jobs to machines, which is a very valid concern in our modern world. According to a study by the McKinsey Global
Okay, the very reason is why everybody needs to college services, and then if you choose, so the time to go to college isn't when you're 30, even though if that's when it is for you, great, but we need to be telling kids now is your greatest opportunity. Now go to college.
To the think tank specializing in economic research, as many as 1 out of every back to school, start a business, just simply use it as a cushion to survive as they look for work. And this is an argument that's been echoed by high-tech executives like Elon Musk and Mark Zuckerberg. While speaking at the Harvard commencement in 2017, we saw Zuckerberg say,
"The greatest successes come from having the freedom to fail. We should explore ideas like universal
constraints on their decisions, and they have more options, agency, and independence. Similar to the automation argument, having extra income could give people more freedom to decide what kind of work they want to do based more on interest than financial need. UBI could also give workers more power to refuse work in bad conditions and for low wages, which could force employers to make pay better and improve conditions. But beyond that, UBI could give people more flexibility in general, whether it's the ability to just find a better job or simply have enough money to buy groceries and pay bills. It brings everyone to a baseline where not only can they more freely make decisions, they can also have more security, which brings us to the third major argument for UBI: rising income inequality and poverty in the modern economy. Right now,
one of the biggest drags on starting a business or doing something on your own is health insurance. Nobody will tell you that the fact that they don't have health insurance available to them at reasonable rates is that, you know, it's not a big factor in my decision to not start a business or to start a business. It's a huge part of it. You've got to either pay a COBRA payment and then make enough money in your business in 18 months to bring on a healthcare policy, and if you have people who are at high risk who are working for you, that policy will get very expensive, and in some cases just prices it out. There are many companies who don't offer health insurance, and in some cases they give them some kind of credit to help them pay for other insurance that they go to find in the healthcare marketplace. But if we want to help people, we need to bring affordable health insurance, not health insurance for all, but affordable health insurance to the table, and to premiums and to universal basic income. Do that. If people knew their insurance is covered, and they'll be covered when they're not able to afford it, or there's an affordable program out there, that would be a huge step in solving two issues. One, making sure everybody has health insurance, and two, giving people that flexibility they want and not being tied to some company for their benefits.
The gap between the richest and the poorest people in America is wider than it's been in the 50 years since the Census Bureau started recording wealth data. People who support UBI argue that it will help close the gap and even the playing field by putting more money into people's pockets. That, according to UBI supporters, could break cycles of poverty that many people are trapped in for generations. And to that point, those in favor of UBI also argue that it can break the cycle of poverty in another way, by supplementing or even replacing welfare programs. Especially in the United States, people across the political spectrum argue that welfare programs like food assistance and unemployment are expensive been ineffective at actually breaking people out of poverty. That is largely because if someone on food stamps or another kind of welfare starts making more money, they lose that assistance. That both disincentivizes people from making more money or finding a job. And the thing is, it also causes a lot of people to fall through the cracks, like those who make too much money to qualify but not enough to be lifted out of poverty. A UBI could provide a simple, maybe even less expensive way to give people money. And unlike welfare programs, which are targeted, recipients could spend it whatever way they want. I hear some argue that people who need the money the most will waste it on buying drugs, alcohol, or other non-essentials. But on that note, early data from a study in Stockton, California, which gives 125 people $500 a month for a year and a half, found that of the money that was tracked, recipients spent around 40% of their UBI on food, 24% on sales and merchandise, 11% on utility bills, 9% on car repairs and gas, and 16% on other expenses. Supporters also argue that this could cut down on bureaucracy and administrative costs in the current welfare system, right? Because welfare programs have rules about eligibility. In order to qualify, each person has to go through this complex and often confusing process that requires high administrative capacity and costs. For example, Social Security alone.
Now, on the welfare side, that's a terrible example. Because there are many people on welfare who don't want to do anything else, or they're on welfare and they operate in a cash environment. I mean, why do you think people are on welfare for many, many years? They're not supplementing it somehow, and illegally. And in some cases, they're on welfare because the people that are employing them aren't paying them enough. So this isn't the answer because it doesn't work. Because pay people that kind of money, they're going to do nothing else. I mean, they'll find a way to survive at that level or do something.
Costs at 0.7% of funding, and even then, that still comes out to more than $6 billion a year. But according to the Cato Institute, other programs specifically aimed at helping the poor run closer to 5%, adding up to roughly $50 billion a year. And from an administrative standpoint, UBI is simple because it goes to everyone. And so with all these tools to address poverty, supporters of UBI believe that it will provide other benefits that go along with poverty reduction. Things like improving health and education outcomes and reducing crime. And in fact, a UBI study that gave money to a farming town in Canada between 1974 and 1979 found that there was a decline in doctor visits, an 8.5% reduction in the rate of hospitalization, and high school graduation rates improved. Other pilot programs in developing countries like Namibia showed both reduced poverty and crime rates while also raising school attendance as well. And with all of that said, there are plenty of other arguments for why UBI is a good idea, but these are the main ones we're going to focus on for now. And from there, we move to the arguments against UBI. Now, to start off, the most common and generally accepted reason people oppose UBI is, of course, that it will be incredibly expensive to give money to everyone. There are a lot of different estimates for how much UBI would cost depending on the country and how much that UBI is. But in general, for most developed countries, experts largely agree that in order to see all the potential benefits that we just described, the base amount would need to be around $1,000 a month. Right, so a huge chunk of money for any country, but especially a country as big as the United States. And according to a working paper by the National Bureau of Economic Research, or NBER, a universal payment of $12,000 per year to each adult U.S. resident over age 18 would cost roughly $3 trillion per year. Right, that's around 75% of the total federal expenditures in 2017 alone. So the question becomes, how would the federal government pay for this? And there are two main proposals: increasing taxes or cutting existing programs. So we'll touch on taxes first. According to the authors of the NBER.
So there you go. So they want to increase taxes to cover $3 trillion a year, and we can't get rid of $22 trillion. So these types of ideas, to me, are just a waste of time. We've got to get a handle, and if you've watched other videos that I've done, we got to get a handle on our budget. So when we're operating in a balanced budget, and even surplus budget situation, and we have our bills paid for, that would be a better in this country than what they're talking. Just like your health insurance, you have plans that are doing different things for different companies based on the size or population of their company, and the premiums are different across the board.